Hello, we are Group 4. My name is Miracle Morel,
I'm Nikita Harris.
and our presentation is on ethical and legal complications and violations, crossings and violations. I'm sorry.
Okay.
Okay, our first thing is the definition of the scope of nursing. The scope of nursing is the education of nurses of their deemed responsibility and roles that they are to do as professional workers to provide care for their patient. It's saying what a nurse is basically, what the nurse is to do once they go into their field, once they start work, how are they to take care of the patient, how are they to take care of all the patients, how are they to act towards the patients in a professional manner and with their coworkers. Ethical and legal boundary crossings. So crossings is kind of like a blurred line because sometimes you don't really know if you have crossed the boundary because it could be very easily to cross that boundary. So with crossing a boundary, an individual may not necessarily know that they are doing it. If a crossing has a potential to go past the set point of what are acceptable actions between a nurse and their patient, a psychologist, a client, or even a teacher and their student. Like the little things could be you crossing the boundary. Ethical and legal boundary violations. Violations go past the set limit of what is acceptable in the professional world. These actions are intentionally done. You know when you violate something that you're not supposed to do. There's no thin line between that. Violations go, like I said, they go past what a crossing is. So in order for someone to violate something, they're doing it in an intentional way. Characteristics of a boundary crossing: easily crossed and may be done accidentally. Like I said before, people may not know that they're actually crossing the line. Professional provider may not know their action is wrong. They may not even realize that the action done for a better good has the ability to be harmful, such as if an individual may have like a fear to something, they may feel like, okay, well, it's my duty to try to help that person, so I'm going to tell that person to go face their fears. But this person ends up to go face their fear, they have a heart attack and die. Now, the nurse is in trouble. But her thing was to help the patient, but now she's crossed that boundary and she has to serve the consequences. Now this patient has died, like there's harm been done to the patient. So, characteristics of a boundary violation: it has potential risk. It breaches the set limit of what is acceptable. It does not have the best interest in the end for the patient or the professional worker. A violation, like this says, I mean, patient is going to feel. I guess the patient's going to be affected as much as the professional worker. Of course, professional worker can become fired, or the patient can end up getting mixed emotions, mixed feelings, things like that. So it's just not the better good for either the patient or the worker. Examples of ethical and legal boundary crossings: accepting gifts, developing an unprofessional bond with the patient, such as developing care for the patient. If you develop an unprofessional bond, you may end up caring for that patient more than you do for your other patients. Like you have to have the same care level for all of your patients because all of the patients need care. You can't pay attention to one patient more than you do to the other because you just feel like you're the only one that can care for that patient, and that's not true. Sharing of personal information, such as personal things that happen at home, should not be shared between the patient. You should not be sharing any personal information with the patient, where you live. Things that happen in your family should not be shared with the patient. Keeping secrets for the patients. Keeping secrets for the patient could cause some type of harm because that secret may be something that could be life or death situation. So you shouldn't keep secrets from for the patient from their family if they're in the hospital or from like the physician because it could help them in the long run. And also breaking patient trust. Examples of ethical and legal violations: having a sexual relationship with the patient, breaking confidentiality, such as, okay, you have a patient that has a disorder and you go to the other nurses and you're telling them what's wrong with the patient and you're telling them that this patient has this and you're telling them the patient's name, their age, what room they're in. Like, that's breaking confidentiality. No one else should know what is going on with your patient if they're not assigned to that patient. You shouldn't be giving out this patient's information. Exploiting the patients. This is things like using the patient to your benefit. You should not be using the patient as to where it could benefit you. I guess I'm trying to explain it. Like, if the patient has dementia or something, and she, I guess if the patient was like trying to give you something, they have dementia, and so they give it to you once, but then they try to give it to you again. You should explain to them, okay, you've already given me this. You don't have to give it to me again. Don't try to use the patient to your benefit. Plus, you shouldn't be taking anything from the patient anyway without permission. And also neglecting the patient. You shouldn't neglect your patient. All patients should have the same care. You shouldn't feel like, oh, I've already did this, so I don't need to go back. No, you need to continuously check on your patients as you are ordered to, and take care of them just like you do with everyone else.
Okay, views on the issue. So, according to the article, Professional Ethical Competence in Nursing, the Role of Nursing Instructors, teaching nursing about ethics is what allows them to provide high quality care. And with so many people having different views about what is right and what is wrong, people think that their beliefs is what ethical or ethics is, and that's not the case, because there are guidelines in place to ensure what things are ethical and what are not ethical. So these were some of the views on the issue. And then we're going to go on to the exploration of the future for the issue. There are many cases where nurses cross and violate boundaries. So in the future, we still expect that. But there are things that we can do in order to eliminate or decrease the number of nurses that get in trouble for ethical violations. And so in one article that was from 2014, there was a summit for nurses, a national summit for nurses, and the summit was called Nursing Ethics for the 21st Century. So we can provide more teaching for the nurses, and at this nursing summit, they came up with a blueprint, and the blueprint was to provide a guide for nurses in order for them to not fall into the trap of being ethically violating patients or anything. And so there were 10 steps that they kind of went over in order to like help this, and so this would help in the future as well. It was like sign a pledge. So apparently there's a pledge about ethics and violations of ethics. And so the second one was partner with people in other organizations. So come up and around others and discuss ethics problems. It say document cases and learn from them. So you document a case where a nurse has been like terminated for ethical violations, and you make sure that you go over that and not make the same mistake that that nurse made. And then it also say add ethics to everyday life. So once you go in with your patient, you should be practicing ethics so you won't fall into the trap. It's also say expand knowledge of ethics, which is like more teaching. So you look into the things that you need to know in order to not fall into the trap of ethics or violating ethics. It say become a member of hospitals, organizations about ethics. So there must be organizations within the hospitals that talk about ethics and come up with guidelines for ethics in a particular hospital or something. It's a review policies before doing things. So reviewing your hospital policies about what they allow and what they do not allow, like as far as accepting gifts or not accepting gifts. Conduct research. Come up with your own research to make sure that you're not violating anything or going over and beyond with your patients and things like that. It's a create a learning environment on the unit in which you work. So to help everybody that's on your unit, you come up and you talk about ethics. That goes hand in hand with more teaching about ethics, because a lot of violations could be from them just not knowing, so a lack of knowledge. And the other one was live ethically with everyday decisions you make. So when you're going into a patient room, you should be thinking about the ethical, like, am I putting this patient at harm? Am I checking things that I need to check? You just have to make sure that you leave no terms unfinished, or so you make sure that you don't lose your license. And the article also stated, be the change you want to see. So make sure that you're aware of the things that are unethical so that you won't make those same mistakes, and that you can keep your license and things like that. So you be the change that you want to see.
Okay, these are examples of brief cases. The first brief case is involving ethical or legal boundary and crossing. So, a trauma patient returns to the hospital facility after being in a bad accident a couple of months later and offers a gift to a nurse that helped him or her while undergoing treatment. The nurse accepts the gift, trying to be nice, and receives backlash and gets suspended from work for 2 weeks. This is a boundary crossing because the nurse is accepting the gift, and this is against policy in this particular hospital. The nurse should have first asked for permission before taking the gift to make sure that it was okay to take the gift. That's the thin line between a boundary crossing. Like, she wanted to be nice to the patient, but in the long run, she could have ended up losing her job just for it being nice and accepting the gift. She should have just got permission in the beginning. So with certain hospitals, they have strict rules on not accepting gifts, or some may accept certain gifts, but you just have to ask permission. Some gifts that some hospitals don't allow, like examples, money. But yeah, you just have to ask permission. Okay, an ethical or legal boundary violation. A patient becomes disoriented and begins to knock things over, taking out their IV and attempts to harm the nurse. The nurse puts the patient on restraints. The physician enters the room and immediately fires the nurse. The nurse is also sued by the patient's family, charged with a misdemeanor, and loses his or her license and can no longer practice. This is a boundary violation, like without a doubt. It was the nurse's duty to ask the physician for restraint permission. You always have to ask for restraint permission before you put a patient on restraint. And these restraints could have caused further harm to the patient. Like, the patient could have continued to be disoriented. They could have confused the patient even more, putting restraints on them without getting permission, because they already don't know what's going on. So you just putting them down and putting restraints on them could cause further harm, broken limbs or something, because they're trying to still get out of these restraints because they don't know where they are or what's going on, what's happening. And so now the nurse is dealing with those consequences because that nurse didn't ask for permission before putting those restraints. Okay, and these are our references, and also a reference that I didn't know whether to document or not was information that we talked about in class, Dr. Tini. So you will also be one of our references. So this is the end of our presentation.
Thank you.